The push to vaccinate kids could help families get together this holiday season.
Yep, and Pfizer is looking at expanding who qualifies for booster shots, seeking emergency use authorization today for all adults, anyone 18 and above.
As usual, lots to talk about with UW Chief Health Quality Officer Dr. Jeff Pothof. Welcome back.
Hey, Dr. Pothof, good to see you.
Good to see you guys again.
So this still has to get approval from the FDA and the CDC, the boosters for 18 and up.
Absolutely. I think we're getting used to this kind of process now where the company says, hey, we've got this data. It looks like it's pretty good. It goes to the FDA. It goes to the Advisory Committee on Immunization Practice. And then after all those steps, it's possible that we could see more widespread distribution of booster doses.
Do you have any idea what the timeline would look like?
I think you're probably looking at least, a few more weeks right now. They'll debate this data. The benefit of the boosters and the folks that are currently eligible, the data's much better as far as that's who we see breakthrough cases in and things like that. But there would be incremental improvement if we did give booster doses to folks after that 6-month period of time where we start to see those really high efficacy numbers in the 90% start to drop down into the 80-70% range.
But it's really worth getting the booster if you've had 2 doses.
Absolutely. There is a study out there now out of Israel. Again, they got that huge health database that looks at the effectiveness of the boosters, and it is pretty remarkable. It truly is a booster. It brings you kind of right back up to where you were after you got your initial series.
And the J&J, you can go to the Moderna or Pfizer.
Yeah, I think, what they're trying to do is they're trying to make it less complicated for folks. And we know that if you mix and match boosters, it's safe. It looks like, if anything, maybe there's some advantage to mixing and matching. It doesn't look like there's any drawbacks to mixing and matching. So instead of having to try to figure out which pharmacy has your Johnson & Johnson or your Moderna or your Pfizer and that it's in stock on the day that you go in and get it, you can pretty much just find a place that offers the booster and not worry so much about the details about which manufacturer it came from.
Well, that's good. That takes some stress out of it. The vaccine is available now for children under 12, and a lot of kids have already received their first shot. What has the demand been like at UW Health?
This is interesting because we've heard about these studies that said, hey, parents aren't maybe all that interested. They want to wait. That is not the story in Dane County. So looking at the different health systems in town, whether it's GHC, who maxed out their vaccination clinic last weekend, SSM has had some school vaccination clinics vaccinating yesterday and today over 800 kids in the Wanakee area. UW Health vaccination appointments going quickly, and talking to a lot of parents who are really looking anywhere within the county and outside the county to get their kids vaccinated, which is just a really wonderful thing to see.
And speaking of Wanakee, we're looking at the video. You were there yesterday with us, 2 very special patients for you.
It was really special for me. I mean, you guys can imagine it's been a rough year and a half, sleepless nights, wondering what's going to happen. And I think anyone who's a parent really resonates with this idea that we just want to keep our kids safe. We want to protect them. And that wasn't always so easy as we went through this pandemic. So being able to give Natalie and Nora their first dose of that vaccine.
Your children.
These are your 2 daughters.
My 2 girls.
Yeah.
That was just a special moment. I mean, it's just that sigh of relief that we're getting there. We're almost there. They're going to be safe. They can get more back to normal. And they were just so tickled to get it, which wasn't what I was expecting after giving them a shot.
It's the only time we've ever heard kids say, I'm so excited to get a shot.
Right, yeah, it's really bizarre.
Because normally they're so afraid of that.
And they have to get the second one in 3 weeks,
Yeah,
21
so
days?
they'll get it on the 29th, and then, 10, 14 days after that, they're going to have really high immunity against COVID-19, which is just really great.
Is this really turning a big corner?
I think so. The last couple of days, our numbers in the state have gone up just a little bit. So there's that, hope it's just some variation. But, things are looking okay. We've got more folks getting vaccinated. We're getting those 5 to 11-year-olds vaccinated. It just feels really good right now. Like maybe this is the last time that, we'll have to talk about this every single week. But winter's coming. We'll have to see how things go.
Yes.
It's not a sure thing yet. But, the more folks we get vaccinated, especially those 5 to 11-year-olds right now, the more likely it is that we can kind of have this go away here in a couple months.
Is herd immunity still on the table? Are we still having that discussion?
I don't think we'll get to herd immunity in the sense that so many people will be vaccinated that even those who are unvaccinated don't have to worry about it. Delta changed that for us with how contagious it was. It upped that number of folks who had to be vaccinated into the 80% range in order to not have that be able to bounce around the unvaccinated. But I do think what we will do is have, low levels of COVID. The unvaccinated will be most at risk. The rest of us will get occasional boosters and should be pretty well protected from it. So I see a future where this is not going to be as big of a deal as it was for the last 2 years.
The girls get ice cream?
Yeah,
Okay.
Culver's, of course.
All right.
Yes, of course.
Doctor, thanks for being with us again.
Great to see you.
See you next week.
See you next week.